back with the Rocket Right Show. I'm Dr. Kay Seller in the house with Hurricane Betsy Barnes, and our medical segment is brought to you by Mary Bird Perkins Cancer Center. And today we have with us Heather Johnson. Yeah, and you returned.
I
mean,
back.
we didn't scare you off or anything.
You did not.
I appreciate it because she gives us such great information. She's the Director of Early Detection and Education with Mary Bird Perkins Cancer Center. And March is Colorectal Cancer Awareness Month. And so I see you're wearing the blue ribbon.
Yes.
And so they don't have a green ribbon for Shamrock's Day. They went blue.
But we went blue.
So now y'all know they're blue. And tell folks what exactly is colorectal cancer, because sometimes people hear colon cancer, rectal cancer, colorectal cancer. Let's talk about what it is and who is most at risk in our community, because also I find out people think, well, it's not me, I'm not at risk. And so let's talk about that.
Yeah. Well, the colon and the rectum are both part of the large intestine. The colon about 5 feet. And the rectum about the last 5 inches that leads to the anus. Cancer can start in the colon or the rectum, in either of the two. So,
right, it's kind of one lung. Just depends on if it's closer to the exit or up higher, which is why, and we'll talk about screening in a little bit. That you need to look up higher in the colon.
Yes.
And let's talk about, the risk factors. And some of that has affected the screening because of the age groups. Now it's actually earlier folks. So I know if folks thought that they, didn't need their colonoscopy till they hit 50, we'll talk about screening in a minute, but that's because they're seeing younger people.
Yes, the thing about colorectal cancer is highly preventable, highly treatable, and you can survive it if caught early. So early detection and education of colon and rectal cancer is very important. While 90% of people that are diagnosed with colon and rectal cancer are diagnosed over 50, we're seeing a rise in people under 50 that are diagnosed.
Yeah, especially when you get to that 40 plus age group.
I have a question about that. Is it because more people are getting screened, so it's being caught earlier in that age group, where maybe before they weren't getting screened as much because there's been such a great push by Mary Bird to push the screening program?
No, the national guidelines have changed because of the age of onset being earlier. It wasn't screening until recently. I think they were seeing younger people getting it. So it wasn't that these younger people were getting screened. Yes. They were being diagnosed, and that's what leads to any screenings occurring at an earlier age.
I was just hoping
people
were getting smarter.
Well, the thing is,
and more diligent about getting screened.
The thing is, the reason we were seeing a rise in it was about 40% of the people that are age risk, they weren't getting screened at all. So hence we've now moved up the age of the screening guidelines to 45. So we're screening earlier, doing more education and more pushes, and making awareness of colorectal cancer available to all.
Right, and I looked at some of your statistics. So if you think, oh, well, that's a rare thing. If you look in the U.S., 1 in 20 men and 1 in 24 women will be diagnosed with colorectal cancer in their lifetimes. And nearly 1 in 3 diagnosed will have a family history. So it is one. Doesn't mean that you're excluded if you don't have a family history, but your risks are greater if you have a family history. So important. So
would it be a family history of any cancer or that specific cancer?
It's a family history of various cancer, but of course higher risk if colon and rectum cancer is in your family.
There's certain ones that cluster and it gets a little complicated, which is why you just need to discuss that history with your doctor to know that. So we were kind of dancing around screening, but let's talk about what are the current screening guidelines?
Well, a colonoscopy is pretty much the gold standard for colon and rectal cancer screening, but that's not the only answer. At Mary Bird Perkins, we provide various ways that you can be screened. You can be screened through a FIT kit, and that's just a test that you take home, and you can take it in the comfort of your own home. It tests for blood in your stool. You send a stool sample in, and one of the indications that something could be abnormal is blood in your stool. So we test for blood in the stool, and upon an abnormal finding, we refer patients for colonoscopies.
Right. And so blood in the stool, sure, it could be benign indications, but it is also one of the factors looking for colorectal cancer.
Correct.
And we were talking about the length of the colon, so you could do a shorter test called a flexible sigmoidoscopy that just goes to the sigmoid colon and have to do that every 5 years. But why wouldn't you want to do the colonoscopy? And if you're good, it's every 10 years.
Yes.
I was that girl. I'm like, yeah, women will complain like, oh my gosh, the prep is awful. I really don't want to have to do it. But if you're good, and this means that you have no family history and they don't find anything abnormal, then you could get 10 years before you have to do that again, and you can feel good about yourself. But, of course, the good thing about the colonoscopy, too, is that it's not just a diagnostic test, because if they see a polyp, they can remove that.
Correct.
So it can actually treat that at the same time.
Yes.
So, that's the beauty of the test that no one wants to have. So, treatment and diagnosis.
Yes, which is very important. Like I said, early detection for preventable and survivable cancer, it just makes sense. While it may seem uncomfortable to some, it's more beneficial just to get it done. And get it done and maintain a regular screening regimen so you're on top of any of those polyps or precancerous lesions that they may find.
That's right. So your doctor may decide that you need more frequent screening based on your family history alone, even if your test is normal, or certainly if there are precancerous polyps or certain types of polyps that are identified during that test. But let's talk about that, because when you go, well, how do you do this screening on the go? Because I know y'all offer screenings, and Mary Bird is really known for their prevention on the go program. So how does that work with colorectal cancer screening?
Yes, Prevention on the Go is Mary Bird Perkins' signature mobile screening program, where we go out into the community and we provide free screenings for 5 types of cancer, one being colorectal cancer. And as I stated earlier, we distribute the fit kits where you can send in a stool sample from the comfort of your own home, and then upon an abnormal finding and further testing to determine if anything is going on. So that's what we do for our colon and rectal screening cancer. We do education, we do awareness, we partner with different organizations such as LDH, which we're partnering with here in March and throughout the year.
So tell people what LDH stands for.
LDH stands for Louisiana Department of Health, and we're partnering with them to increase education, to increase awareness and screenings throughout the state. So the goal is to increase our screening rates by 2% in 2022. So by leveraging our funding and leveraging our resources and working with our partners in the community, we hope to raise awareness for colorectal cancer, have more people get screened that are age appropriate, and make people more comfortable with talking about this disease before.
You're going to do this statewide?
Yes.
That's a wonderful thing, because there's probably some communities that don't have access to some of the same testing. We're so blessed to be located in Baton Rouge near Mary Bird, so everything's easy for us. But it's not so easy for people maybe in rural communities that don't have the availability of the test.
Our Prevention on the Go program offers free screenings throughout a 30-parish area that spans from North Louisiana all the way here to South Louisiana. So these are made available. If you want more information about those screenings, we do have a website, marybird.org, or if you know already that you want to sign up and you're interested, we have a hotline you can call to assist you in making appointments, and we can educate you on when the screening is closest to you, because another part and a unique part of our Prevention on the Go program is that we go where you are. We go where people work.
And that's a great thing.
We go where people play. We go where they worship, to make it more accessible to you if you have a hectic schedule. If you need screenings on a Saturday after hours, we have a wide array of things to make the screenings more accessible to you throughout our service.
And I think a lot of times that's folks, excuse, couldn't take off work, or I was too busy, I was like running here with the kids, doing this and that. So lots of opportunity. One, to get educated more about it and realize how important this screening test is. But going to that website, finding out where are one of the screening on the goes, where can I go access this?
Anywhere where you can hear or watch our show, they offer screening. Because you can hear us in 31 parishes, you can see us in 22 parishes on television. So this is a great opportunity. If you've never had early detection before, this is your chance. So we hope that you'll take us up on that invitation, right?
And thank you so much for helping spread the word. And we have been talking with Heather Johnson, who is the Director of Early Detection and Education with Mary Bird Perkins Cancer Center. And thank you for all y'all do for the community. And appreciate you spending the time with us this evening.
Thank you for having us.
Thank you. Come on back.
I will.
And up next, we're going to be talking about a little fun happening, some miracles going on with Leanne Miracle out at Point Marie. So stay put.
A lot of fun.